to just tell my story to kind of illustrate some of the themes of how this harm actually plays out. My math works. Thank you. I was what can be called a troubled kid or at-risk kid, although I don't really like those terms. A lot of problems in my family. My father is a Korean War veteran. There was a lot of real climate of fear and trauma in my family. My mother is a sexual abuse survivor. My father is also a survivor of the psychiatric system in the 40s and 50s. He's an electroshock survivor. He was locked up repeatedly. So there was a lot. Our family was really in trouble. But I have to say that the mental health system really came through for me at that moment because it didn't do anything about the situation. I fortunately, because I'm in my 40s now, if I was younger, I probably would have gotten a diagnosis as a teenager with the huge risks that go along with that. But I was able to avoid that, and we needed help, but we didn't need the kind of help that's being offered to young people today, which is medication, diagnosis, and really a verdict of you have this lifelong problem that you're not going to be able to end because there's no cure for it. So I sort of made it through my childhood. I had a lot of different kinds of things that I called depression, but they really were a lot more than that. I would get very, very withdrawn. I would stop communicating. I would have visionary experiences where I remember a few times where I felt like I was being attacked from someone behind me, trauma kinds of experiences. I would see images of cartoons on the ceiling. I mean, there was a lot of really different things happening with me, but I was also a very sensitive and creative person. I didn't really sort of see how these patterns were related until what I called my depression really started to affect me in my early 20s. And I went to a doctor, and I ended up leaving the doctor's office with a free sample of Prozac. And this is back in the days when, I don't know if you remember, but Prozac was really considered this amazing wonder drug. It was actually on the cover, I think, of Newsweek magazine, kind of floating up in the heavens, what wonder drug. And I took Prozac and immediately lifted me out of my depression and lifted me even more out of my depression, lifted me and lifted me and lifted me and lifted me. And pretty soon I was on the moon. I mean, I was having a manic reaction to the Prozac. So before hospitalization, before going into becoming a client in the system, I was harmed by a medication reaction. It wasn't recognized then as much as it is now, although it's still not recognized, that mania can be a reaction to the antidepressants. I spent years in shame and confusion from that experience because I didn't know what had gone wrong. I just sort of really suppressed and repressed the experience, the memory of it. I lost my job. I mean, this is a big career move. I'm coming out of college, going into work world, and then suddenly it collapses because I have this very shameful, embarrassing encounter where I'm, wearing weird clothes with my going into work with weird clothes and getting into arguments and having these really kind of wild, ambitious ideas about how I was going to start an organization and start a movement. And, well, actually, some of that kind of ended up not being so delusional, but the way my interpersonal skills were really not very good in that state. And so I lost a job, and that was actually the point of my kind of summit for my income and my career. Like my income has never gotten to the point of that moment when my life took a very different turn. I've never been able to get back to that point in terms of back in the work world and money and things. So I lost that job, and I was very isolated from my community, which often, people know your community is often centered around your work. I was very isolated, and things just started to deteriorate. And what I had been calling my depression, or putting under the label of my depression, really started to come strong, and I became more isolated, more withdrawn. There were a lot of different factors: malnutrition, poverty, this shame experience that I'd had, the isolation from other people, a lot of different stressors. I would sometimes smoke marijuana as a way of trying to deal with my experience, and that was not helpful. That contributed to it. I don't think it caused my problems. So it was one of many, many different kinds of stressors. My nutrition was horrible. I was drinking coffee. My sleep cycle was completely reversed. And so I, at the sort of end of this long downward process, I was in a very, very bad state that would be considered psychotic, and was considered psychotic. And I was leaving out of the window of my apartment because I was so afraid of the housemates in my apartment, that they were thinking about things about me. I was walking the streets, believing everyone was beaming information into my head. They were trying to hurt me, and there were all these different kinds of plans that people were making. I was really in very bad state, and so I went to a clinic. I tried a number of different medications at this point, and I should have known what was coming, because you don't just go into this clinic and sit down and talk with them. You go to the door and you go to an intercom and you say your name, and they buzz you in, and you go inside and the door locks behind you. And I had no idea. People know what's coming, but I had no idea what I was getting into. And so I was not related to as a person in trouble. I was never asked, what do you need? Would it be helpful to go to the hospital? Do you want to take a break? What would be helpful for you? I was observed like a clinical subject and assessed, and they actually did some pretty manipulative things to kind of test my stress vulnerability. They kind of some mind games kinds of things. And then I was told, I'd been told, you're waiting for hours and hours and hours, the doctor is going to come, we're going to talk to the doctor. But they were just stalling, and then when the clinic did close, they said, well, you're not going home, you're going to the hospital. And I said, well, I don't want to. I want to go to work the next day. And they said, no, you can't go to work. And so I was forcibly committed to the hospital, and it was a really traumatic experience for me, and they put me in restraints. I was completely withdrawn and shut down, uncommunicative, and I wasn't resisting at all. I would not even verbally anything other than just say I wanted to go to work. Why are you putting me in the hospital? And I was put into restraints. I was put in the back of an unlit van and taken to San Francisco General Hospital. And that experience, that moment, that first break moment, was incredibly devastating to me. I was reeling from that. I had nightmares of being raped from the restraint experience. I was extremely disoriented. And looking back, I was having trauma symptoms from my entrance into the so-called care system that's trying to help me. So I was in a very fragile, very vulnerable state. I needed a delicate human connection, and what I got instead was being tossed into a crowded psychiatric emergency ward, which is total chaos, TVs blaring. Everybody was in one room, and it was just not what I needed at that time. It was really terrifying. This was Langley Porter Psychiatric Institute, which is actually considered one very high-quality institute, but the experience of the trauma of going into the hospital was never recognized. I was never given any kind of, it's like, what just happened to you? Let's talk about what you're going through right now. It was all set aside and suppressed, that could actually be harmful, although it was. And I spent a year in the mental health system, in the public mental health system. I was in and out of the hospital. I was locked up for several months. I was in a seclusion room at one point, and my seclusion experience was just, they were threatening me with strip searching me. Fortunately, I was never physically aggressive on the ward, because I think I could still be in the public mental health system if I had fought back, because that's when the treatments would have really escalated. My medications and everything would have really escalated. But I was very withdrawn. I had what are called negative symptoms, or very kind of quiet in myself. But the time when I was put in seclusion, it was in the middle of the night, and I was just so in myself, and I started to have some pathway. I found some pathway out. I just wanted to talk to somebody because I had some insights or some thoughts, and so I came out of my room in the middle of the night, and that was apparently some rule that I had broken, and the reaction was just this very hostile, get back into your room, and I was in such a fragile state that just escalated, and this happened so many times that the level of caring and consideration just isn't there, and so providers, professionals end up provoking a response from a client. Again, I wasn't aggressive or anything like that, but I started to argue because I was so cornered, and then that's what ended up getting me into a seclusion room, which was just, I still don't remember that whole experience. It was so traumatic that I blacked out some of my memory from that experience. So